Time is now 21 minutes past 9 o'clock.
The Breakfast Club with Keith D'Souza.
Yes, indeed. This is the Breakfast Club on your morning fix right here on 938 now. Now, Singapore, we're told, has one of the highest prevalence rates for childhood myopia. Now, recognizing the significant public health implications, Plano was first conceptualized and developed by the Singapore Eye Research and Institute, Singapore National Eye Centre, SERI, SNEC, I can't even pronounce this, Ophthalmic Technologies. Am I pronouncing that right, Mo?
Ophthalmology. You're doing a great job, Keith.
Technologies Incubator Program, and of course it's supported by the National Health Innovation Center. We're talking about local myopia parent management app, which is the brainchild of Plano, and the managing director, Dr. Mo Dirani, is in the house, and I'm pronouncing your name right, Mo.
Correct again.
Thank you so much. So let's talk about myopia in Singapore. It's significant. If so many of our children are suffering from this, can this be arrested? Can this trend be arrested?
I think before we go on, you mentioned the Singapore National Eye Centre. So I'm quite fortunate that I can stand on the shoulders of giants.
Okay.
So we have people the likes of Professor Donald Tan, Professor Tien Yin Wong, who are world authorities on the subject matter.
Right.
And I've spent the last 10 to 15 years as well on myopia research. So the quick answer is yes.
Okay.
I think the onset of myopia can be delayed. If you delay the onset with interventions such as Plano that addresses risk factors associated with myopia, it means you then reduce the chance or risk of developing what is known as high myopia. And high myopia can then lead to more sight-threatening consequences. So yes, you can delay the onset, and yes, you can slow the progression.
Sure.
So in essence, Plano's ambitious goal is to really save sight.
Before we talk about what Plano is, if you want to get in on the conversation, if you have a child who might be suffering the onset of myopia, or you have a myopic child, how do you manage the condition? Give us a call, 669-11-938. We've got a doctor in the house. We'll leave it to him. So, Doc, what is Plano?
So Plano is an innovative and smart intervention. It's an application that works in the background of phones and tablets, and it addresses smart device management as well as myopia.
Okay.
So it captures real-life data and feeds back to the user. It enables parents to schedule timing and to better manage the device use, and it encourages through a reward system to get children outdoors.
Okay.
And to get them to reduce behaviors such as holding the device too close to their face, spending too much time on the device, not having the appropriate breaks, and adopting the right posture.
And in the moment we have a doctor in the house, the phone lines are buzzing. 669-11-938 is our number. Let's see who is joining us at the moment. A very good morning, sir or ma'am. Could I have your name, please?
My name is Lee.
Mr. Lee, you have a question for Dr. Dirani.
Yes. Can I know whether if you have a very low myopia and if you do not wear glasses all the time, will the myopia get worse?
Yeah. The myopia gets worse if you don't wear, spectacles and things like that.
So I think that's a good question. If your child is diagnosed with myopia, they'll be given a set of spectacles or contact lenses. I think it's disservice to the child if they're not wearing their spectacles. But not having their spectacles on means they may use material or hold material quite close. And this is something that Plano addresses to ensure that they're moving it away. But that could be an indication that they've either got a bad habit or their myopia is increasing, so their glasses need updating. So what I would advise is to ensure your child is compliant with the spectacle wear and to ensure that they're not removing it, because those with myopia are short-sighted, which means their near point of vision is quite close and they can see clarity, but it's at very close distance, which we discourage.
So does that answer your question? Does that answer your question, sir?
Yes, you do. Thank you very much.
Thank you very much. I'm glad we could have been of help. 669-11-938 is our number if you want to, excuse me, while I clear my throat. 669-11-938 is our number. Get in on the conversation if you want to. We're speaking this morning with Dr. Mo Dirani, the man behind Plano. Doc, what's the earliest case you've seen of a child in Singapore developing myopia?
Well, I mean, we talk about Singapore, and Singapore's known as the myopia capital of the world.
Wow.
Yes.
Okay.
But it's a global epidemic. By 2050, half the world will have myopia.
Okay.
So it's not isolated as a Singapore problem. And so we know before kids even start primary school, up to about 10% will have myopia. By the time they're done with primary school, about 50%. And then up to 80%, 8 in 10 children, by the time they're done with secondary school, have myopia. So is myopia a problem? It's a no-brainer, of course it is.
Yeah.
But interestingly, it's sort of increased in the last couple of decades with the emergence of the digitalization of the world.
Right.
So it's no surprise that increasing device use with our 8-year-olds spending 3.5 hours a day, our 12-year-olds spending up to 6.5 hours a day. It's not a coincidence that the prevalence of both device use or inappropriate device use and myopia increasing in parallel.
We're putting the cart before the horse. We could find out what causes this, but the phones keep buzzing. Good morning, sir or ma'am. Do you have a question for Dr. Durrani?
Hi, Mr. Durrani.
Yes, Dr. Durrani. Yeah.
Dr. Durrani. Yeah. Okay. In this market, because my child has some myopia, then someone actually recommended me to actually bring my child to some exercises that like looking far, near, and then left and right using lights. You see. So I'm not sure whether such a thing is quite straining for the child, like 30 minutes exercise, just looking left and right, to be able to decrease their degree in terms of their eyesight. Does this exercise really help?
So I'm going to put my scientist hat on.
Okay.
And so we do know that excessive amounts of near work and the lack of outdoor activity exacerbate myopia. Number one. Number two, Singapore is incredibly rich with ophthalmologists and optometrists.
Okay.
So I strongly advise that you consult the optometrist at hand and the ophthalmologist at hand. In the sense of exercise and looking out into the distance, absolutely. Having frequent breaks from reading and using your device, absolutely. And that's what Plano advocates on its application. So, but doing exercises for 30 or 60 minutes, I'm no expert as to whether that's going to arrest or slow the progression of myopia, and I advise that you get expert consultation. But at first instance, I would recommend the spectacles, distance viewing, and outdoor activity. I cannot stress how important outdoor activity is.
So I hope that answers your question, and perhaps you should stay tuned, and we'll find out how you can get your hands on Plano when we come back with the Breakfast Club after an update of what's happening in the world and on the road. Stay with us. You're listening to your Morning Fix right here on 938 Now. This is the Breakfast Club.
The Breakfast Club with Keith D'Souza.
How do you protect your kids and build healthy device habits? You might want to consider this new app that is available on the App Store. It's called Plano, and the people behind it are in the house this morning. Dr. Mo Durrani is the man behind Plano. Doc, with all of this developed in Singapore, are we still not restricting our kids' device management, if I could use that term?
Well, we've conducted research locally through AntsWorks Consultants, which consolidates that of the literature at a global level.
Right.
There's an appetite for these applications. Parents address and acknowledge the problem with excessive device use. I think we can do better.
Right.
And it's not the technology that's the problem, but it's rather the relationship we're developing with the technology. You mentioned Singapore before. This is certainly developed in Singapore.
Right.
It's a Singapore success story. It's a Singapore baby.
Right.
And we will lead the world in both managing device use and myopia. So it can be downloaded on the Play Store, on the App Store. And I would like to congratulate the Singapore stakeholders as well as our users, because we've had over 50,000 downloads with a conversion of about 10%, which means over 5,000 parents have already registered, and that number's growing. And I think with our current partnership with the Health Promotion Board, that's doing a tremendous job in health promotion, good eye care habits, as well as sending kids outdoors. I think collectively we can sort of slot into this comprehensive program where Plano will be promoted to 320,000 children, preschoolers and primary school goers over the next 12 months.
Hold that thought. Our WhatsApp number is 963-11938 if you want to get in on the conversation. If you can't call us, you can text us And, of course, our number is 669-11938. Doc, is getting out there the be-all and end-all of perhaps arresting this myopia trend?
I think number one, it's education.
Okay.
Because we've got the acceptance and the uptake and the appetite from the parents as well as the children.
Right.
I think number two is empowering the children as well to be able to interact in a healthy way with their device, and also having the important stakeholders on board, including both industry, government, and the clinical world. So yes, and then from Singapore we intend to expand.
What was I know the rationale is that you were in the myopia study for the longest period of time, but why the app? Why technology? I mean, if we're restricting kids from using devices, I'm going to need this for the kid to look at in the first place.
Yes.
Yeah.
I don't think we can deny children, nor can we deny adults, technology and digitalization of almost every facet of our life.
Right.
But we can change behavior. The uptake of devices is very high. In Singapore, there's about 3.3 devices per person. Wow. So internet penetration is almost at 100%. And it's very similar figures across the region. So we cannot come in and try and riot against devices, but how can we work best with the devices to ensure children are enjoying their technology, but at the same time reducing the adverse health outcomes, of which one happens to be a sight-threatening condition, myopia.
Some people will say, well, I had myopia as a kid. It's a genetic thing. My kid will more or less develop something, at least on one side of the family. And if it does get bad, we'll just go and get LASIK.
Well, that's one argument. LASIK is not for everyone as well, and it's an expensive exercise, and you need to be eligible for the surgery itself. Right. We know from our science conducted at the Singapore Eye Research Institute, where I'm a fellow, as well as my twin study back when I did my PhD, giving away my age now, in 2006.
And he's just a baby.
That myopia is a complex condition, which means it's got genetics and it's got environmental risk factors.
Okay.
The environmental risk factors are excessive near work, as well as holding books and devices too close to the face, and the lack of outdoor activity. There are other risk factors, but they're the main focus areas. And we know that 2 hours a day of outdoor activity actually reduces the progression. Why is it so important? You can get some specs, contact lenses, or get surgery. Right. Well, 1 in 10 will develop high myopia. Okay. High myopia is then associated with retinal detachment and other pathologies that are a lot more sight-threatening. So, yes, it is important. And there's also social and quality of life factors that are associated with spectacle wearing, as well as contact lenses and so forth. And contact lenses don't go without the risk of infections and so forth.
Are you managing your child's devices and how they use it, or perhaps they are looking at you as to how you use your devices as well? Give us a call, 669-11938, and share your experiences with us. And perhaps you'd like to put a question to our guest this morning, Dr. Mo Dirani. He's the man behind Plano, and incidentally, he is an eye doctor as well, and he'll be more than able to answer your queries. Doc, when I was a kid, now it's the devices. When I was a kid, they said, if you're watching too much television, that's why you're getting, getting blurry figures. Go and stare at the sun for a couple of hours and come back, and then we'll see whether you have, do you have to restrict your kids' devices?
It's actually not far from the truth. Yep. Viewing the TVs is a little bit better than what we're currently doing.
Right.
Our 6-month-year-olds are getting 45 minutes of screen time exposure.
Wow.
Prams are being developed with iPad holders and other tablet holders. It's an issue, but we can intervene. Looking out into the distance, getting outdoors are actually good tips that we had. I remember back when I didn't get a phone until I was 20. Wow. Now, our 7-year-olds, 50% of them, and we know that through our research with AntsWorks, have their own device. By the time they're 10 plus, most of them have a device. And those parents, almost 100% of parents are comfortable to give their 3 to 8-year-olds their device.
Wow.
And so...
You keep them quiet.
Well, perhaps. But right. I think parents are becoming more aware of the potential adverse health outcomes. And this is why we've had such a good uptake with the Plano app.
We are talking this morning with Dr. Mo Dirani. He's the man behind Plano. It's an app that helps you or your children manage their device use. But as an aside to this conversation, when did you allow your child access to a mobile device? Or did they grow up with a device attached to one of their appendages? They came out of the womb with an appendage, with a device attached to them. 669-11938 our number. Our WhatsApp number is 963-11938. Doc, when parents come to you and say, I can't restrict my kids' device use, what do you say to them?
Well, we're getting positive feedback that once they have conversations, they empower their children. So the research that we conduct, we actually do focus groups with kids.
Mm-hmm. So with the app available on the Play Store and the iOS Store, what does it allow parents or kids to do?
So the parent has a complete platform where they can set time scheduling. They can actually say dinner time between 6 and 8. There's no device use whatsoever. Mm-hmm. We also encourage them to do that and put a deadline in the sense of sleep time.
Right.
We don't encourage devices at the dinner table, family engagements, and so forth. The Plano app has a reward system, so kids get points. Okay. We want to ensure that we empower kids and not police them or enforce our behavior changes. Mm-hmm. Those points then lead them to the Plano offerings. Right. And the Plano offerings, we've now partnered with over 100 companies in Singapore that offer creative activities, outdoor activities, sports, and so forth. So for all those companies out there in Singapore, reach out to us. Because what we intend to do is offer experiences and developments that change the mindset of kids. And this is why we want to get in early, because this behavior change will then benefit the children beyond the eyes. I don't want to complicate this conversation, but the amount of sedentary behavior is increasing. So people sitting, kids sitting, the lack of physical activity, the lack of personal engagements. And we also know, not to sort of take this to a dark area, that excessive device use leads to internet addiction syndrome. Right. And internet addiction syndrome can lead to mental health issues and in some cases suicide.
Indeed. We were talking about bullying online, and now we are talking about device addiction. If your device is indispensable to you at the age of 7, it might pose a problem. Plano available on the iOS Store as well as the Google Play. We need to go for a short break. We'll come back and ask Dr. Durrani what he hopes you will get from the conversation that we've been having right here on The Breakfast Club. We're going for an update of what's happening in the world and on the road. Stay with us. A very good morning.
The Breakfast Club with Keith D'Souza.
Have your kids been outside today, sans your device? Well, you might want to consider that given the fact that your device use or their device use could be a major contributing factor to myopia here in Singapore. We are speaking this morning with the managing director of Plano, Dr. Mo Durrani. Doc, we've been talking about kids, detaching themselves or getting your kids to detach themselves from your mobile devices. Spend some time outside with kids developing myopia so early on in life. In the moments that we have left, what do you hope parents will take away from the conversation we'll be having?
Well, it's been very encouraging in the sense of uptake. We invite parents on a weekly basis to come visit our offices and actually give us their honest feedback. Okay. I think they've identified the fact that we're not just a parental management app, and we have a solid health, a solid science, and institutional support. So we encourage parents to come back with their feedback, and we intend to evolve and fine-tune our product to ensure it's meeting individual needs.
So let's get a little technical right now. Artificial intelligence, how does that play a part in Plano's workings?
That's incredibly smart. So we're building an AI capability. Right. We have simple algorithms. I'll give you an example. So by the age and the last time the child had an eye examination, Plano actually formulates or through an algorithm when the next eye check should be. And that's based on a framework that's embedded in the country, and there's frameworks across the globe. Right. So what we're doing is we're actually increasing traffic of children and parents into optometry and eye care, because that's important. Early detection leads to the best prevention. And unless we're picking them up very early, we can't come in with a holistic approach of getting kids outdoors, managing their device use, and engaging them with good eye health habits.
Should I feel that my child is developing the onset of myopia, should I seek medical advice, or just go to the optometrist that many people seem to be doing these days?
The optometrists are well equipped to ensure that they provide the appropriate correction and treatment. But what you can do as a parent, and you sort of touched on this previously, is that I don't think we set great examples as adults.
Indeed. Okay.
This is where this is in the future, but we're talking Plano adults, where our behavior on devices is not so great. So I think also a good strategy is for parents and carers to set a good example.
Boundaries, perhaps?
We've got geolocation boundaries, we've got time scheduling, we've got blocking of apps, URLs. I mean, it's an incredibly comprehensive application that works in the background and it's seamless. Because remember, we don't want to be disrupting their technology time. They might be doing their homework on it, or might be doing some research or whatever it may be. So Plano app works in the background and it's very seamless, non-intrusive, it's free, it's accessible, and it's a friendly application.
Plano, available on the App Store and Google Play Store. If you have more questions for Dr. Dirani, you can hit us up on our Facebook page, 938 Now, or you can drop us a note on our WhatsApp number at 963-11938. All it remains for me to do is, Doc, thanks for coming in so early in the morning. So you come back, talk to us again.
Thank you very much. You're a legend, Keith.
In my own mind. In the moments that we have left, let's see what's happening market-wise.